While folks are rolling in, we have to do the disclaimer that says I cannot guarantee that there won't be an angry teenager running through the background or
dogs.
Or dogs, yes. Or dogs. Well, good morning. We are going to go ahead and get started. We are probably about 30 seconds before 10, but we will welcome folks as they roll in as well. But we want to value your time together. Welcome on behalf of Grand Valley State University Center for Adult and Continuing Studies. And we are glad that you joined us today for our inaugural Safety Perspectives webinar. I say inaugural because I do hope that you will have grace with us if we, as mentioned, have any teens run through or dogs run through or are a little clunky with some things, but we are glad that you are here. Today we'll be looking at both the regulatory and the management perspective of safety, and we'll be hearing from two folks that we think are experts. And more than hearing and listening to what they have to say, we really hope that you take advantage of this opportunity to ask. We put in the email that this is an opportunity to ask them anything related to safety perspectives, and they're brave and courageous for being willing to tackle whatever may come. Before we do introductions and get started on the content, I would like to do a bit of Zoom housekeeping. And this session is being recorded. We will send your recording to you via email. You are muted if you are a participant, and yet we do encourage you to go ahead and ask questions in the question and answer box, and we will either address them as we go along through the presentation, or we will save those for the end and have more of a dialogue after that is wrapped up as well. If you have any problems finding the Q&A, I'm assuming many of us are Zoom experts by now, or at least getting closer to being some with all of the virtual meetings we've had. Please feel free to use the chat and reach out to me. I'd be happy to help. I'm Melissa Perino. I'm the Director of Educational Outreach, and I am thrilled today to be able to introduce you to our speakers. First up, I'd like to introduce you to Deb Zeal. Deb is currently a senior occupational safety consultant at the state. She is part of the consultation, education, and training team, part of the division of MIOSHA. It's a role that she has held for nearly 15 years. She also spends most of her time training in Mid and West Michigan on MIOSHA regulations. Prior to this role, Deb has accrued 10 years of experience in safety and health in private industry. We're also very proud that Deb is a GVSU grad, and we are proud to call her a Laker for a lifetime. Welcome, Deb. We're glad you're here today. I would also like to introduce you to Derek McCormick. In addition to 17 years of safety experience, Derek is currently a faculty member at GVSU in the Occupational Safety and Health Department, which is a longer way of saying that Derek is preparing great interns and future employees and can reach out to him for some of those opportunities. Also a certified safety professional and brings the perspective of his law degree from Western Michigan University Cooley School of Law to the conversation today. Welcome to you both, and thank you for spending time with us.
Thanks for having us.
Let's get this rolling.
Okay, so when I was asked to do this, the question was put out, who's going to be the audience? And it came back that it was going to be mostly manufacturing. So this presentation is geared for manufacturing, but we do have information from OSHA, from the CDC, from who dealing with healthcare as well. So as I did notice in the role sign up that there was some healthcare facilities as well. So if you have specific questions on healthcare, feel free to ask as we're going through. So when this was originally put together, and you can find this presentation exactly as it is here on our MyOSHA webpage, right at the very first page that you go to, if you went to michigan.gov/MyOSHA. In the orange box at the top, there are several presentations available. The one that I'm presenting here for manufacturing was updated last for Executive Order 2020-77, which has then turned into 91, which has then turned into 97. We are constantly evolving. So it was put together on May 11th, and as of May 27th, the orders have not changed significantly for the executive order rules, nor has the CDC or OSHA information changed. There's just additional information available since then. And we encourage all employers to keep up to date with MyOSHA, with the CDC, with federal OSHA, et cetera, as far as the recommendations. So this was written for the 2077, but the information is still the same in 2020-97. When the executive order came out for workplaces to start opening again, basing off of the 77, and like I said, 97 is reflecting the same thing. All businesses with in-person operations must, according to the executive order, develop a COVID-19 preparedness and response plan. OSHA has a guidance out there, and it's available in the executive order. There's a link to the guidance for the executive order that helps you prepare this response plan. You can call it something different. It doesn't have to say COVID-19, but you do have to have a preparedness and response plan. Emergency preparedness and response plan is fine, but you do have to address COVID-19 in some way. How are you as an employer? Just anyone. This is not for manufacturing. Every employer has to start considering how you're going to restrict the number of workers on the premises, how you're going to promote remote work, and what you can do remotely as much as possible. So where you had office staff coming in every day, is it possible for them to do it from work or from home and only come in on a limited basis? What does that look like for your facility? Is that something that you can do? You have to maintain 6 feet of social distancing, and if you can't, there are some additional requirements, and we're going to talk about those later. Some of those additional requirements are going to be requiring some kind of a face mask or a face covering. If you cannot maintain 3 feet of distance, you may also want to consider using face shields, not in lieu of cloth masks or surgical masks, but in addition to those masks, considering face shields. Your cleaning and disinfection protocols is going to be required. Increasing your current standards, putting something in place. Uh-oh, are you not hearing me? My computer just told me my speaker is not working.
It's coming through, it's just a little staticky.
Uh-oh. I don't know if I can do anything to fix that.
It's just gone away now. It's only seems like when you go into important concepts that it starts to get staticky. So we'll stop, I guess, when something comes through, and I can interject as well.
Yeah, if you can't hear me, we can stop and you can kind of take over for me, Derek, or kind of expand on.
Oh, we can hear you fine now, so we can proceed, and then I'll jump in if it starts to get staticky again.
Okay, thank you. Mm-hmm. And then implementing workforce daily entry screening protocols. And I think we've all seen what they're asking for. They're asking for a questionnaire and they're asking for temperature screening. So when OSHA put out their guidance, they put people into categories of risk. Okay, so based on your exposure. We had very high, high, medium, and low. So very high is obviously when we have individuals who are coming into contact with people who have cases of COVID-19. High is going to be likely to have, so this would be your medical, your dentist, nursing home, potentially labs, etc. And then medium and low is more likely where we're going to see a majority of people for manufacturing, at least here in Michigan. We also have retail, restaurants, things along those lines. So this is how they've set up their guidance. You as an employer need to determine where you are, where your employees are for their risk category and how you're going to mitigate their risk. What are you going to do? And we're always looking at the hierarchy of controls, which is that we are going to try to eliminate possibility. We're going to try to engineer it out. We're going to try to administratively control it. And last case scenario is PPE. Unfortunately, PPE is taking a bigger role than we usually anticipate in safety, but we're there right now. So consider how your people are potentially going to be exposed, how you're going to remove those risk factors as much as possible, keep your current federal, state, and local guidances in place, including your executive orders, implement basic infection control measures, and we're going to talk about that, and develop policies and procedures. As I mentioned before, we're going to look at the hierarchy of controls as much as possible. The OSHA webpage has a lot of information on engineering controls, on administrative controls, and PPE based on your risk category. For manufacturers, again, I can't push enough. There is just a lot of information coming out from federal OSHA. There are guidances that they have available. There are posters that they have available. Reminding employers of what steps should be taking place. Some of the highlights are reminding your employees that they should frequently be washing their hands for at least 20 seconds, using sanitizer where it's appropriate and available. Avoid touching eyes, and sometimes that's eyes, nose, and mouth. That's just something that we need to keep vocally training on, because it's so easy. As soon as you say don't touch your eyes, how many of you just went, I want to touch my eyes? But we have to keep reinforcing that information. How to cough and sneeze appropriately around other people, respiratory etiquette. Avoid close contact with those who are sick, staying at home if they are sick, and recognizing personal risk factors or underlying conditions. And employers need to put controls in place. How are you going to control people staying at home if they are potentially sick or they have underlying conditions? So this is a HR and safety conglomeration that you have to do. Again, there are several fact sheets available between CDC, federal OSHA, and MyOSHA. Keep your eye on all of those. I'm not going to go through each of these bullets. We've kind of already been there, but there is many resources and I encourage you to use them.
So one of the things that I looked at is how do we actually implement some of these practices, was to try and find resources that give you a step-by-step process for each area that Deb spoke about earlier. From the prevention measures you can see in the checklist of isolation, PPE, and screening. And you'll go, the next few slides that we talk about are just some checklists of things that we should look through as employers and say, what do we have in place? How are we going to address this? I just feel like it gives a better structured model for addressing some of those concerns that, you know, if you were to go off and just look at all those resources that are out there, can be a little bit intimidating and a little bit hard to follow. So I've added these slides with these checklists to help guide you towards putting some processes in place. So if you want to go to the next slide. So Deb mentioned employee screening at the forefront. One of the big pieces of this new executive order is how are we going to screen employees for health conditions? This is something unique, and we're in uncharted territory as safety managers or HR representatives to have to do something like this. So what process can we put in place to make this easy to follow? And also, how do we make sure that we're consistent in doing this, and people are completing these truthfully as much as possible? I know I've talked to some frontline workers in construction, and they were talking about this checklist and basically said, do you want to go home for the day, or you could just write yes in some of these and they'll send you home. So things like that are going to come up. How do you address that and make sure that people are taking this seriously? A lot of times there's that big push up front that this is important, we need to do this, but it starts to wane off, days down the road, and as people get a little more desensitized to this. So this is just another checklist that you can see addressing some of the different common areas or places where workers are going to be. And I think this gives some good control methods. This isn't, required control, but these are some things to think about as you go through your workplace. For instance, workstations, the 6-foot rule is there, but if we're unable to do that, can we do relocation, remote work, put up physical barriers, or as Deb mentioned earlier, face shields in addition to face coverings. Signage, we'll talk about signage in different areas. And again, we need to make sure that our employees are consistently notified of the workplace requirements that are as we start up. One last thing I see break rooms on here is I teach in a classroom, and we went through last week and we measured between each desk, how we can have students in there, how many students can be in the classroom for lectures to maintain 6 feet of distance. Normally we have about 28 students capacity in the classroom. With this 6-foot distance rule, that drops down to about 15 to be able to safely do that, and they have to sit in a crisscross pattern with desks, and that's how we were able to do that. So are you able to do that in your break rooms where you're also putting X's in areas that alert employees where they're not supposed to sit? And obviously in the summer months, is it possible to have some outdoor seating that may be easier to accommodate some of the social distancing that is necessary for breaks? Other things, cleaning and sanitizing, having some real structured procedures for shared equipment, shared spaces. It's a challenge. So think about how often you have gone through and wiped down your computer keyboard, even despite new knowledge that we have out there, how important that is. It's do we put up a time on Friday afternoons or even more frequently that we go through and do these wipe downs, putting some more structure to the process versus having employees just say, do it once a week. That's easier to get away from you as an organization than say every day at 10 a.m. or, we wipe down our computers, or even more frequently if necessary. Again, it's important to just establish some consistent measures to address these. But these checklists hopefully will give you at least a way to think about what are you going to do in these different areas, how are you going to sanitize, how are we going to set up distancing requirements and protect our employees. Another thing that is important is also the communication piece to employees. So you can see signage requirements or guidance on signage, that hand washing instructions, spacing guidelines. Again, we're trying to change behaviors for employees. So how do we have to consistently communicate. For anyone that's ever tried to implement a program or policy or safety procedure, you know how many times you have to enforce that with employees. This is really no different. And one of the things, there are resources that I found on the CDC website for signage, that these are free signs that you can print and put in some of these areas. They address a lot of the things, such as stay at home when you're sick, hand washing, social distancing, a lot of those things that we've talked about, and give you that free resource to be able to do that. But it's just important to make sure that these are in a visible area for employees to see, and we're helping maintain that message across the board in all of our facilities.
Okay, so face coverings versus respirators has been a very big issue over the last few months. And so I wanted to address a few of the things that we've come across. So when the governor and the Surgeon General and federal OSHA and CDC are requiring masks to be worn, because respirators and masks are kind of used interchangeably as far as verbiage, people got a little confused. So I hope that we can clarify some of that. Requiring masks to be worn when distances of 6 feet cannot be maintained at every employer should be happening per executive orders and general duty under MyOSHA. If you cannot maintain 6 feet of distance for the cloth coverings, you should consider, not mandated, but consider the use of face shields when people are getting closer and closer together. Again, this is just another potential barrier, not in lieu of the cloth coverings, but in addition to the cloth coverings. Train your employees on how to wear and use their face coverings properly. If you're going to be using the ones that have a tight-fitting nose piece, the idea is to use it the way it was designed. Cloth face coverings are not N95 respirators, and our next slide is going to talk about that a little bit more. The Maryland Department of Labor has a fantastic face covering fact sheet. It goes through, what is a cloth or paper face covering, what's a surgical mask, and what is an N95 or a half face respirator, and what does that mean to the people who are wearing it? Okay, so is it tested and approved? Is it intended for, what's the intended use or purpose of that mask or face covering or respirator? And then it goes into, okay, as an employer, if I'm going to require my people to be using a respirator, what does that mean for the employer? For the fit testing, if it's required, fit testing, medical evaluation, facial hair prohibition, Appendix D, training and cleaning and storage, all of those things have to take place if the employer requires an N95 or half-face respirator. Face coverings are not going to fall under the respirator standard and do not require any of these things to happen. So you'll see if you're doing a face covering, a cloth face covering or a surgical mask, nothing in that second box is going to apply. If you have a N95 mask required, then you have to, for voluntary use, nothing except for training and the signature on the Appendix D of Part 451 in the MyOSHA standard needs to happen. And we can talk about that in further detail if you have questions later. What you need to know, cloth face coverings and surgical masks do not require a standard to come into play. When you hit the N95 or a half face mask voluntary or mandatory use, the respirator standard comes into play and the employer is now responsible to do some things to be in compliance with OSHA or MyOSHA. So let's talk real quick about the requirements for manufacturing. And again, I understand that that doesn't apply to everyone, but a majority of this is going to apply across the board. So according to the Executive Order 2020-97, it does identify 16 additional requirements for manufacturing. There are more for healthcare, but we're going to talk about these 16 right now. When you have employees that are entering the facility, make sure that you have created dedicated entry points for daily screenings, using barriers or locks to prevent people, not from the inside. You should always have an emergency exit, but stop people from getting into other areas of your facility from outside that do not have these dedicated checkpoints. Do not allow anyone to bypass those designated entry points. There should be a screening protocol in place. So for all individuals, your employees, visitors of any type, customers, etc., you need to have a screening process. And that screening process is going to ask them if they've had symptoms of COVID-19 or been in contact with any individuals with known or suspected COVID-19 cases. Also, we are encouraging temperature screening to be used in addition to the questionnaire. No touch thermometers is what we're asking for. We understand that they're getting very short supply at this time. And then following manufacturer's instructions for proper use. Training is going to be key. The amount of MyOSHA complaints in the last 2 months has quadrupled. It is absolutely huge. And I cannot stress communication with your employees as much as possible. But according to the executive order, at a minimum for training, you should be telling your people about the routes of person-to-person transmission, the distance that the virus can travel, symptoms of COVID-19, steps to require to report symptoms if your employees are having them, who they should contact, facility COVID-19 preparedness and response plan. So by June 1st, every employer in the state of Michigan should have an emergency response plan for COVID-19 available to their employees via web page, via training in a classroom, hands-on contact, but you should be training your employees on your preparedness plan as well. Having rules and procedures to reduce exposure and the spread of the virus, and how you are handling PPE, its selection, maintenance, and steps to properly wear and remove if you've upped that because of COVID-19. So for workplace controls, as much as possible, promote telework. Get people out of the facility if you can. Suspend non-essential in-person visits, including tours. So, you know, if you have customers come through for tours, if you have the public come through for tours, it's time to put that on hold for a little while. Reduce congestion in common areas such as break areas and lunchrooms, and implement rotational shift schedules if possible. So if you are not running 24/7, but have the ability to change it to 24/7, so you have less people coming in through the doors at one time, or alternating their days of the week, or staggering your start times, we're encouraging that as well. For workplace controls, installing temporary physical barriers when feasible between workstations, if you can't maintain that 6 feet, between cafeteria tables. So this is our engineering controls. These are physical barriers. Creating protocols to minimize contact, and when you have deliveries coming in, to limit the amount of exposure between your Amazon driver, your UPS driver, etc. Adopting protocols to limit the sharing of tools and equipment. Excuse me for just a second.
So I'll interject here as well. Just some of the things that you're doing. The sharing of tools and equipment, doesn't make sense to purchase other equipment if it's hand tools or things that that can be easily, purchased to minimize how much sharing is happening. Again, having the availability of disinfectants and wipes for employees to use, they're much more apt to use them if the shorter distance they have to go or the easier it is to access these types of disinfectants that you want them to use. So it's just important to take away a lot of the barriers that employees that are not maybe used to doing this on a regular basis, to take away those barriers to make it easier to implement and follow in a sustainable way.
So for workplace procedures and sick employees, upon identification of getting a case within your facility, your employees need to notify plant leaders. This should be part of your exposure control plan. Notify your potentially exposed employees. So anybody that they've come into contact with. Now, tracing is difficult depending on the size of your facility, and we understand that. But where you know they have a department, a common restroom that they use on a regular basis, a cafeteria, a break area, things along those lines, we need to notify people in that area that they may have exposed. You're going to maintain a central log for workers who received a positive test from COVID-19. If you're working in healthcare, there might be a direct relationship for recordable cases. If you're working in manufacturing, that is not necessarily the case. But if you have it reported, we want you to keep track of it. If more come out of it, and we've seen this in the meatpacking industry quite a bit. If we have a quarter to a half of the employees being testing positive for COVID-19, we can make a pretty strong case that it was work-related. So keep track of them as much as possible. Send your potentially exposed individuals home. Encourage your workers to self-report and shut down the facility for cleaning and disinfecting if you do have a positive case come in, and basically up your game for disinfection.
So I added this slide on just some other additional considerations for managing the return to work. And Deb mentioned this almost on her first slide, was just developing that preparedness response plan, whether it's an exposure control plan where you bring that out and modify that to include COVID-19 preparedness. That is right out of the executive order, and almost everything on this slide comes right from there verbatim. So you can see one of the things that's important to include in this plan is that there's a supervisor that is on site at all times when employees are present on site. So who is going to be your designated supervisor that's going to manage this program and understand what to do if somebody comes down with symptoms, disinfectant policies, sending employees home, all of that, thinking about how does that work in your organization. If you run one shift, that may not be a big deal, but running a 24/5 operation or even 24/7, who's, that third shift supervisor needs to understand what's expected of them for management of this program. And then the other piece, the training piece, Deb talked about this quite a bit at the beginning as well, is providing this training to employees. So think about employees that have not been at work for the last 8 weeks or more, and how anxious they may be to come into the workplace. Some may be really excited to come back into work. Some may not want to work at all. Some may just have some anxiety about the exposure to coming in the workplace. So part of that training should be, the focus I always look at is how do we ease some of those concerns with a really good plan that we're putting in place, and also how do those employees report unsafe conditions. Deb mentioned how many MyOSHA calls were coming through for complaints. I used to manage a lot of OSHA complaints that would come through from the employer's end. And one of the first things, I tried to do to help reduce those complaints was provide a really good channel for those employees to voice their concerns, training your supervisor how to respond to these concerns. If, for instance, if there's an employee that's not wearing a mask or face covering as required, or is not following your social distancing requirements for your facility, how do you treat those concerns that may be brought up in a way that is respectful to the employee that's raising the concern and prompt and not dismissing them? Your ability to break down some of those barriers and address those concerns can help minimize and help reduce the number of complaints that may go beyond your management. So I always want our employees to give our managers a chance to respond to those before calling my OSHA.
Derek, I'm going to interject. This is Melissa. I'm going to interject a question that we received here because I think it's relevant to timeliness and it's relevant to protecting our employees as well. This question comes from someone who is not in manufacturing, but who says, if I have a firefighter who is exposed to a patient who tests positive and we were not informed to use airborne precautions, is the employer required to quarantine them when, for example, they get emails days later that they had a potential exposure?
If they were not wearing any kind of protective gear and they were exposed, it would, yeah. Again, my OSHA is going to lean on CDC and federal OSHA requirements. The executive order basically says that you should have a plan in place for quarantining or not having those people exposing the rest of your employees. So, and there should be no disciplinary process for those people who have been exposed and or feel that they have a positive case. So strongly encourage you to come up with a policy for quarantining if you have known exposure cases. But even more importantly is to keep track of that individual. Even if you allow them to come into work on a regular basis, they're going to have a higher level of questionnaire and screening process to begin with, and I would limit their contact with other people at your facilities.
Thank you. That's great. We'll go back to the next slide. Are you ready to transition?
Yes. Other considerations, just piggybacking off of Deb's slide from face masks versus respirators. What is your policy going to be for face masks for employees as they come to work? Are you going to provide them and have control over what is worn in the facility? Are you going to allow people to bring them from home, making sure that they meet that they're covering the face effectively as your management has determined is appropriate? So what are you going to do? How are you going to address that as conversations that should be had well before employees start up at work when you decide to do so? Other things, there may be employees, how many people have on this call have worn a mask to Meijer or to another, shopping center or just out in public, and realize how uncomfortable that is. It does restrict breathing, even if it's just a cloth over your face. And if somebody is not used to wearing that, especially in the summer months, those are some challenges that we should think about beforehand. So do we provide more than one option for employees to explore and find what's comfortable to them? If somebody cannot consistently wear one, it's just too much. They can wear it for a period of time, but then it's a challenge. Do we look at putting them in an area that is, maybe they're not in close contact with others and they're able to maintain the distancing throughout their shift. Even if it's intermittent, then these face masks are required. But are there other things that we can do for those employees? Other things, heat stress concerns. This adds another element to heat stress. Wearing a mask, if you were to wear a mask while working yesterday on a plant floor, 90 degrees outside is usually means 95 plus inside of the plant. So there's other considerations of do we stagger breaks a little more? Do we provide more water? Change outs of masks, just the things that are going to come up with hot weather that make this an additional challenge for wearing these masks. And then lastly is inconsistent enforcement or just consistent following your established practices. If we say we're going to do something, we need to do this regularly. When we're concerned about employee complaints or just employee comfort or even just complying with the guidance that's required of us as employers, we need to make sure that we're consistent in how we do this. So whether it's a checklist, making sure that those checklists are done by employees throughout the day, whether it's distancing requirements, break rooms, how does our manager or supervisor go and address this situation where we can go and talk to employees and remind them to maintain their distancing. We all know that those things happen all the time where somebody's not wearing safety glasses or doing those things in the facility. This is another one that we need to make sure that we're able to enforce it in a respectful way, but do what we say we're going to do at the end of the day.
Thank you, Derek. And before we move on to the next slide, I'm going to ask another question of you both, probably for Deb. One participant asks, with the significant shortage of cleaning or disinfecting products available, they're having to look at products that require eye wash stations. And they're wondering if there will be an interim ordinance coming from OSHA that it allows for temporary eye wash stations for areas that traditionally would not have had eye wash stations available, like office buildings, etc.
I'm sure that there's going to be some kind of leeway that you'll never see in writing, if that makes sense. So for like your traditional household levels of like any office area, if you're buying up bleach, for example, although the SDS does require you to have some kind of an eye wash available, my OSHA and OSHA rules kick into place when you buy more than household amounts, if that makes sense. So if you're buying a gallon of bleach or something else that is highly corrosive and you're keeping it at your facility, that's still at a household use. And it makes our ability to enforce the eye washing rules a little bit fuzzy. It's a gray area right now. I would do what I could if it's possible for you to at least buy the squeeze bottles instead of the 15-20 minute flowing eye washes that you would mount to a wall or install at your sinks. Do that. And then if you're getting those highly corrosive materials, make sure you are training your employees. So hazard communication is still going to be playing into this strongly, as far as making sure your employees don't mix their chemicals, especially if you have bleach and ammonia or other combinations that are available at your facility. They know not to mix them. And if they are exposed, what are their first aid measures? Those are going to be key. And HAZCOM and part of HAZCOM. So make sure that you have a well-established plan for any new materials that you are bringing in.
Thank you very much. That was helpful.
So briefly, I have here just stay updated. Things are constantly changing. I mean, at the end of February, we were just starting to hear about COVID-19 and response plans. And in the last 2-3 months, it's almost changing on a weekly basis. Since May 11th, we went from Executive Order 77 to 91 to 97, dealing with how we're going to bring people back to work. So it is constantly moving. Stay abreast of all these changes with CDC and OSHA and MyOSHA. We have links on our homepage for commonly asked questions. We also have links now for, or we have a 177 free toll-free number that people who are concerned can call in to MyOSHA and ask questions to talk to a live person about COVID issues.
Deb, we're losing you a little bit there.
Oh, sorry. There's a toll-free number on our MyOSHA page to ask COVID questions. Did you hear that?
No, we did. Thank you. That's great. And we will make sure we include the links in the presentation as we send.
Since everybody is getting a copy of this, these are all links that will be updated as things change. So the links will remain the same and the information will be updated as it goes. And similarly for this, these are all live links. Maryland Department of Labor has some really good information on it. The American Industrial Hygiene Conference has some very good fact sheets for going back to work. And the Minnesota has a good check sheet that we can also send out, preparing employers for bringing their employees back to work.
Thank you. And it looks as if the links are live, so folks will be able to click through to those as well.
Yeah. That's the end of my presentation.
Let's go ahead and open it up to more specific questions. After we say thank you very much, both of you, for sharing the information as of today. And we do know that it will be changing and it is likely to. Thank you to those of you who already asked some questions. Are there some more questions from folks who are joining us today? Or even comments as far as best practices you've seen or heard? I know you spoke about the need for communication, and signage is one thing, but I heard you both saying communicate, right, in many different ways. And it is tough. I know that it's tough for everyone professionally and personally right now. And just wanted to say thank you all for the work that you are doing to protect your employees as well. If we had prizes for questions, you know, we would be throwing them out right now. That, you know, no candy. Does that mean you can have candy before noon if you ask a question? Oh, good. Here's one. There's a lot of research going on right now with decontamination with masks. Excellent question. Anyone, either of you, hearing like how folks are decontaminating masks or what's working for disinfecting them? I assume that's the essence of the question.
And we're talking about the N95s, where most of the hospital care is extending the use by putting personal masks into individually marked bags and basically using them for several shifts instead of one.
I assume that's part of it. I've also heard and wonder on a personal level, right, how I've heard don't touch your mask, have it on your face. And so when you have employees that are coming, you know, and you've provided them with a mask, how are you sort of decontaminating those as well?
Yeah, and every facility is going to be different. So they're going to have to ask the question, if you're providing the face masks, are you going to have a laundering service? Is it going to be treated kind of like your more expensive gloves that you have at your facility or sleeves? Do you provide the laundering for that? We're not forcing anybody to do that. It could be part of your education and training to your employees that they should be taking them home nightly. Again, this is not for your healthcare, it's for your manufacturing. They have to establish a protocol, train their employees, and enforce what they're preaching, basically.
Okay, thanks. I assume that question got answered there as well. Here's another one. Are there any particular retention requirements for the daily self-checks?
Not for my OSHA, unless you have a positive. Now, and not for any period of time, but if you have a known case and it's, you have an employee that's been exposed, you need to monitor that employee. I wouldn't extend that more than, so 14 days is what they're saying is your potential exposure before you have known symptoms, if you're asymptomatic. But if you have people who have known symptoms or known cases, then I would be keeping that for about 30 days and see if anything else comes out of it. Does that make sense? Because one person having an exposure, then exposing other people, it could take up to 30 days for anything to pop up within your facility.
Great, thank you. We had planned on going to 11, but if there are no questions, I certainly don't want to cut the question time short. I also, as we've said, it feels like a broken record. We've said it before, but we will send out the slides as well as the presentation and some contact information. Here's someone is actually sharing a resource, and thank you very much for doing that. Stephen is sharing a resource. He works at Spectrum in Grand Rapids, Spectrum Health, and has an employee symptom checker tool that is available for employers to use if they need a tool to screen. So thank you. In addition to some of those other, he's attached a link here. Stephen, if you don't mind, we'll go ahead and share that out with folks as well in the email that we send. So thank you for sharing that with us as well. I'm seeing another couple of questions. This is good. Folks don't really want to leave, so we'll get a few more in. Should we only use current approved decontamination methods? Back to that.
Yes. Follow the CDC guidelines.
Follow the CDC guidelines. Thank you. If we quarantine an employee and have them tested, do we have to wait 14 days if they test negative?
No, that's what your screening is for. I'm not sure if Derek has something to pitch in on that.
Just to be clear, so somebody has been exposed but tested and the test came back negative, do they need to be quarantined?
Yes, for 14 days.
Yeah, I believe monitoring through the checklist, and if anything changes, it would be important to, highlight that employee to make sure that any changes in symptoms or anything are reported immediately.
Our high and very high exposed employees, and we're doing everything we can. We assume that the employers are doing everything they can to mitigate or to reduce those exposures. So they're exposed on a daily basis, and maintaining their asymptomatic or not getting the COVID-19. So just increasing your level of awareness for those employees for screening purposes is strongly encouraged. We can't enforce or tell you must put them into any kind of quarantine.
Great, thank you. I'm gonna jump around a little bit in the order of the questions. And I'm gonna ask them, speaking of requiring things, back to the decontamination piece. For example, there's only 3 methods that are listed for decontamination that are approved by OSHA. And what if an employer is using a method that is not on the list?
Are you doing your due diligence as far as trying to keep things disinfected as much as possible? Do we put out guidelines? Absolutely. Are we the end all of knowing exactly how to control this virus? Probably not. You have to be able to show that you are using approved chemicals, you're using approved PPE, you're putting it on a time frame, and document the method that you are using and your reasoning why. So if you're doing anything less than what we're recommending, you should have some pretty strong reasoning or documentation of why you've chosen to go that way. Otherwise, it is a potential for why did you not at least do the minimum requirements that we are recommending.
Great, thank you. That's helpful. All right, there are 2 more questions that I'd like to try to get in. Speaking of PPE, and do used PPE and cleaning materials need to be treated as biohazardous waste?
I'm going to say no. I can get back to you on that, but no, unless they're biohazardous waste is meant for bloodborne contaminations. So
I
there's
did see a,
had a bloody nose when you sneezed. I don't think so.
yeah, I saw on the CDC website a resource on throwing away used PPE and methods. There that is out there. Um,
But not in a biohazard.
I agree. I agree. I don't believe it to be a biohazard.
Thank you, and thank you for asking the question. And then, unless something else pops up, since we have a couple of minutes, the last question that I have right now is, are there any guidelines for disinfecting fleet vehicles?
There's nothing that I'm aware of that we've put out, but similar to what I've seen, any kind of a aerosol spray is what most people are using, just to be able to cover as many surfaces as possible, including your cloth and your hard plastics and metals. So aerosolizing as much as you can is probably your best bet.
Yeah, there was just one other point I wanted to make on just on the respirator face covering piece, because it's come up, and as I've been in the general public, I see some people are wearing respirators with an exhalation valve on the front of those respirators. Those actually don't protect anyone besides the person wearing it, and the portion of the face covering that is why this is necessary is it's to protect others from your own saliva or moisture droplets. So if an employee wants to wear their own respirator with a exhalation valve or on it, as the employee, as the employer, you, as Deb spoke about earlier, you have to follow that Appendix D voluntary respirator use, but that really doesn't satisfy the face covering requirements as it was intended. So I would discourage the use of a respirator for an employee in a manufacturing site that it's not necessary to be used.
And to go back and to clarify, face coverings are to protect everyone else but you. Okay, this is a courtesy that we are doing to everyone around us in case I go to the store today, I come into contact with COVID-19, I'm asymptomatic for 14 days, but I'm capable of spreading it to up to 40 people on a daily basis. That's why I wear a covering, so that I don't expose them when I'm talking and spitting, and we just do that as humans. When we get into that high and very high risk, and we're starting to look at respirators to protect the employees, that's a different category. It's for their protection at that point. But that's why respirators are meant for people to protect themselves. Face coverings are for us to protect everybody else, to clarify.
Great clarification. And one last question that popped into, and the person may have missed this earlier as well, but in offices with cubicles, is this general area considered a shared space? And would it require a face covering at all times?
Well, it depends on who's in the cubicle. I mean, if it's your dedicated office area and really nobody else comes in unless they knock on the side of your cubicle or something along those lines, then it's your office and you're separated by 6 feet and you're not spitting on people for the most part. But if you are sharing that between multiple shifts or multiple supervisors or multiple employees and you have shared equipment like computers, yeah, you're upping your game for disinfecting and protection. Yep.
That's great. Thank you so much. I will wrap this up now, and once again, thank both of you for sharing your expertise, your knowledge, and your experience with us. I also appreciate your willingness to answer, specific questions. I know there was one more that I didn't get to about some decontamination issues, but again, we'll be happy to connect in with you afterwards as well. We will send the recording as well as the slides with links to you. And I thank each and every person who logged on. We actually had like a 90% attendance rate. Many times I know folks just RSVP to webinars to get the recording afterwards. And so we're thrilled that we could have so many people join us live and have some questions answered, and let us know if you'd like to hear more as well. So thank you very much.
Thanks for organizing this, Melissa.
We're thrilled. Thank you.
Thank you.